Yeah. So, yeah, good morning, everyone. Thanks for giving me this opportunity to be knowing you all and to, of course, talk about my meta-analysis and systematic review. I am Lipi Mishra. I am working as an intensivist here in Sir Charles Gardner Hospital in Western Australia, Perth, which is a tertiary unit. And this is specialized in neurosurgery, neurocritical care, as well as the liver transplant and cardiothoracic unit. I also am working as an intensivist in a non-tertiary patients. So, Australia.
Yeah, so I am a Professor Kapil Dev Soni. I am a professor of critical care at All India Institute of Medical Sciences, New Delhi, AIMS. It's one of the most premier institute of the country. I work at JPN Apex Trauma Center, which is a part of AIMS, New Delhi. Thank you, ma'am. So, welcome, Dr. Lipi Mishra, and I'm glad that I'm interviewing the lead author of the paper of systematic review. So, can you tell me about what prompted you to consider a systematic review on this topic, and how did you come across this topic?
Sure. The consideration for this systematic review actually stemmed from the high frequency and the critical importance of the arterial catheterization procedures happening in the intensive care units, as well as the emergency department and the operating rooms. Despite its common use, arterial catheterization is associated with complications such as the bleeding, the hematoma formation, and atrial vasospasm, especially when there are multiple failed attempts during the cannulation. So ultrasound-guided arterial catheterization has already shown to improve the first attempt success rate, but still it is not without its challenges, and in particular when it is being done by the inexperienced operators. So that made me think about, is there any new innovative procedures in this field which would be valuable? And that started my looking into the literature and to basically offering an easier technique that may increase the success rate and reduce the complications. As I work in both the tertiary and the non-tertiary hospital setups here, I have observed that the non-tertiary settings often have more junior doctors with fewer opportunities to practice these procedures, so which leads to higher failure rates. And reviewing again the literature and everything, it became evident that yes, this is something which I can explore, and additionally to all of this, my area of interest is teaching the junior doctors. So I believe that this technique can significantly aid to their training and improve their procedural success rates.
So, what do you think is the most important finding of your systematic review and meta-analysis? And were you aware about the landscape of the evidence which is available in this area?
Sure. So first thing is about the most important findings of the study. So most important finding as was the significant improvement in the first attempt success rate of the arterial cannulation by using the acoustic shadowing assisted ultrasound compared to the unassisted ultrasound. Specifically, this meta-analysis did show the risk ratio for the failed attempts are almost, it was 0.47. Indicating a substantial reduction in the failure rates with this acoustic shadowing technique. Additionally, also it was obvious from the study that the incidence of hematoma formation was significantly lower in this acoustic shadowing assisted group. So these findings actually not only enhances the success of the procedure, but also improves the patient safety by reducing the complications. And the failure, I would also like to actually emphasize on the second aspect of all this is the failure rates not only impact the patient outcomes, but also impacts the morale of the junior doctors. Repeated failures do create a vicious cycle amongst these junior doctors. We get demotivated, and then the other people who are present during the procedures, there is a potential for them looking down on them, and which can compound the problem. So obviously, this improving success rate is very crucial for maintaining a positive learning environment and confidence among the junior doctors. Your second question was that going back to the review of the literature, and I mean, there is obviously after the ultrasound guided techniques and with the new ultrasound, basically we are talking about the needle tracking. There has been a previous literature which has suggested that there is a quite a first rate success rate and improvement in it. but still it has its own demerits. It still needs a hand-eye coordination amongst the junior doctors, and especially in an environment where it is a busy environment and we cannot give enough of assistance to the, or enough of assistance, or we are not going to supervise them all the time. It makes it very critical for them to be doing it alone. And so definitely with this acoustic shadowing, it is more helpful for them.
Okay, so one of the group which you looked at was pediatric versus adult. I came across that you actually did a sensitivity analysis, removing a pediatric age group.
Yes.
Why was that done? And do you think there's any specific group in that in which this technique would have a larger effect size or will be much more beneficial?
Yeah, sure. Yes, obviously. So first I'll go to the which group we feel is a more beneficial one. So the patients who actually will be more beneficial in these groups are the patients who will be at higher risk of complications from the traditional techniques. And in those categories, we can think of the obese patient, the patients who are more edematous, or obviously the hypotensive ones who have where the palpation techniques often fail. It is also useful in the other ones, like in critical care environment, where we require a precise and quick arterial access for monitoring and treatment. Coming back to your question about the pediatric and neonatal ones, I mean, to be honest, my husband is a neonatal pediatric. So with his discussion, we do want to see whether it is helpful in it. But we do know that that cohort of patient, the pediatrics and neonate, is a challenging cohort. And with this now coming up with this arterial line, it is also a very common procedure for the management of a critically sick neonates or pediatrics. And there, the environment for the junior doctors is more challenging, given the nature of being to be inserted in a small babies or neonates or preterm. So obviously there was a very limited one study, if you can see from the meta-analysis, which did suggest of the improving success rate in those challenging populations. But still, I feel that's like we need to have more of the use in those categories, and you have to have some randomized control trial to be obviously able to say that yes, this is definitely of benefit in that cohort of studies. And then last but not the least, I feel that this technique is very, very useful for the inexperienced operators to get them to facilitate a higher success rate with minimum complications.
So, do you use this technique in your day-to-day practice or in your routine practice? And were you using this practice before you conducted this study, or you just started recently after performing or doing this study?
Yeah, sure. So yes, I actually myself, I did try a couple of times with the acoustic shadowing before I started on to looking into the depth of it and meta-analysis. But this study did highlight some good things about it, that it can be used both by the expert and the novice clinicians, where it is potentially making a more success rate in terms of cannulation. Recently, I have started it in both in my teaching as well as in my practice in the hospitals where I am working. It is too soon to be definitely comment on this its overall utility, but my initial observations in the last 10 to 15, what I have been doing with mostly the junior doctors, are quite promising. And so I am hoping to be conducting a randomized control trial in my setup to formally evaluate its effectiveness and to gather some more robust data around it. Yeah.
So you said that you wish to conduct a randomized control trial to
Yes.
formulate much more new evidence and have a data.
Yes.
So when I was writing the editorial on your this systematic review, one of my concern was that out of 6 studies, the 3 were performed by one particular group of investigators. And what
Yes.
happens is, if one group of investigators is working on a particular topic, they with passage of time, they get themselves better with that technique. So instead of the effect coming from the technique, the effect is coming because they are becoming much more proficient.
Yes.
So do you think there's actually a need to increase the scope of this randomized control trials and to perform a much more wider, not only restricted to radial arteries, but also the femoral artery, which is common in the shock patients?
Sure. Yeah, you have asked a pretty very good and a bit long question for me. First thing is, yes, you're pretty right in saying that basically the majority of this study part is coming from one particular group who actually have been using it. And that is my aim, to actually get this study more from junior doctors, which will give us a very obvious, like I want to actually know whether it is really being helpful for the junior doctor in increasing the attempt like success rates versus decreasing the complications, and not for the very senior category of performers who are already pretty good with the hand-eye coordination or ultrasound use. And moreover, we do have some high-end ultrasounds here which has the dynamic needle guidance techniques, which I want to actually, which makes our procedure pretty easier than the normal like anatomical landmark guided ones versus the just that ultrasound guided ones. So that will be very, very useful to see when I finish my study, to actually get to know whether it is more useful for the junior doctors. And your second question, your second question was about, can you just tell me about the second part,
So,
which
so my question was that because there's a group of investigators who are performing this technique and they are getting it better with time, and most of the
yes,
effect size is coming from that group.
yes.
If we have a wider replication of the result, wider replication of the study, we'll be able to know which specific group of patients are getting benefited, and is it really adoptable in the practice?
Yes. So with the, yeah, I mean, it has to be, a study has to actually be, I feel, going in a different departments with a different cohort of the patients. And which is going to be like in ICU, we will be having more of a hypotensive patients, but at the same time, I would like to see whether I can get it run in the emergency department to with the very junior doctors who are performing the arterial line procedures, and also to see whether in the theater as well as in the ICU we will have the cohort obese patients where it will be more useful. But these will be the challenging patient cohort where we need to conduct this study. But I can
About
see a lot of potential in this acoustic window guided ultrasound. Yes.
Okay, so because most studies were done on radial artery cannulations, and most of the femoral artery cannulations were not included in the randomized control trials. Do you think it's a need to perform the same study in the larger vessels, specifically the femoral artery, where or in the patients who are in shock state?
So for this, I mean, there will be a little bit of limitation in, it is quite useful, and it will be very useful again in the femoral arterial cannulation, for the femoral arterial cannulation. But I think in terms of coming up with the randomized controlled trials, it would be a bit tricky to get it done like with a substantial number of patients here, because we all prefer to do the radial artery cannulation as far as possible, given the fact that it is more beneficial and we don't want to go into the femoral lines unless needed. But I think where it is being inserted, more than that, if the technique is useful as a first attempt success rate as well as less complication, it should be useful also for the femoral artery. Yes.
Okay, so this my final question is it possible to incorporate this technique in a routine ultrasound machines in the future,
Yes.
inbuilt in the machines itself, rather than using a radiopaque strands from the surgical gauze or a thin metal wires?
Yes, so it is quite possible that this technique could be incorporated into the routine ultrasound machines in the future, because the study actually is discussing about the potential for ultrasound probes to be designed with the features of this acoustic shadowing. We already have this built-in M mode lines and probe markings. Also, we need this dynamic needle technique guidance are available in some of the advanced ultrasound machines. Therefore, integrating the acoustic shadowing techniques into the routine equipment is actually a realistic possibility, which can actually lead to a broader adoption and routine use of the acoustic shadowing assisted ultrasounds. And the more important thing is, once it gets incorporated, we will be minimizing our time for extra preparation which is needed now to actually being able to put the whatever, whether it's a wire or we are putting the gauze pieces of those strands to make it acoustic. I think this is
Yeah,
absolutely
so
possible.
that's really important because one of the outcome in your study was the time to preparation, and that was not significant in your meta-analysis. It was one of the secondary outcomes. And
Yeah.
if you have an inbuilt double acoustic shadowing in a machine itself, it will significantly reduce the time
Yes.
and can improve this outcome itself.
Yes.
Thank you for speaking to me, Dr. Lipi Mishra, and I'm really privileged to talking to you about your good work. And I hope you replicate the result, perform study in your own settings as well. Thank you for joining in the Indian Society of Critical Care Medicine and Journal of Critical Care Medicine interview. Thank you so
Thank you
much.
so much, Dr. Soni. Thank you. It was very nice talking to you. Thank you.